Good morning. As always, I'd like to thank Jay and Vicki for translating this morning. So here we are. We've come out of the Thanksgiving holiday, and it's obviously too early to tell whether there will be a spike in new cases as a result of the Thanksgiving holiday, but we are watching the numbers closely. And I want to thank those of you who changed your behavior, changed your tradition this year on Thanksgiving to try to lower your exposure to others. I know I heard many stories of people throughout the county who were doing Zoom holidays. They were meeting outside, and it was chilly that day, if you'll recall, meeting in people's garages with the garage door open, or simply doing something just with your immediate family. So thanks to all of you that heeded that call and did things a little differently this year. And heading into Christmas, I have a feeling we're going to have the same exercise and make that plan and see how that plays out. But as I said, we won't know for a couple weeks whether or not there was enough of a change to keep those numbers down in Hamilton County. Talking of the numbers today, the positive cases in Hamilton County sit at 33,874. Hospitalizations are at 1,674, and the total death total in Hamilton County is 376. The additions or the increases from last week, week over week, increases in positive cases sit at 3,943. The hospitalizations are at 77, and the death is at 4. So this morning, in addition to Greg Kesterman, Health Commissioner for Hamilton County, we also have Dr. Rich Lofgren, who is the President and CEO of UC Health, with us today. Dr. Lofgren will discuss the critically important subject of hospital capacity. In addition, we've got a special guest, Valerie Boykins, who is a member of the Commission on Women and Girls, and she's here to talk about a very important subject, the stress of COVID-19 on women and girls in our community. This week, the Commission on Women and Girls, is releasing a set of online resources for those suffering stress and trauma from the changes in their lives caused by the COVID pandemic. The Commission created a video to raise awareness that stress is a normal reaction to the drastic lifestyle changes the pandemic has caused, and to let women and girls know that they are not alone and there are resources to help. Women and girls needing support can also visit the Commission's website, the Hamilton County Commission's website, for county resources available at hamiltoncountyohio.gov. So before we play this video, I'm going to turn it over to Valerie, because the Commission on Women and Girls, as many of you know, was established a few years ago. And we meet every month. We meet virtually, but we meet every month. And as we were doing our work related to pay equity and raising women's voices and promoting period products in schools for girls, and there was this conversation about how do we do our work, and with the recognition of the added stressors because of COVID-19. And how do we kind of get real about that and recognize that we're in a really unique time, and what is our role in pushing out information and help to women and girls, in this case, because it's the Commission on Women and Girls doing the work. And I don't mean to say that it's exclusive to women and girls, but that obviously is the focus of the Commission. And how do we, kind of change our behavior and do things a little bit differently this year because of the pandemic? So I'm going to turn it over to Valerie, because it really was a percolating thought amongst the members of the Commission. And so we then responded to that and said, how can we do this, and how can we do it together? So Valerie, I want to turn it over to you just so you can talk a little bit about the thought process, those conversations, and then we're going to go to the video. So with that, Valerie Boykins.
Thank you. Thank you so much for your time and attention to this very important matter. I wanted to put a face on the stresses and the emotional toll that is taking on individuals during this pandemic. when you hear individuals who are either working remotely or who have been furloughed, you kind of think of them in the abstract. But from a personal standpoint, women, and particularly in my life, close friends who are dealing with this in a way that they never would have envisioned. So a very, very good friend of mine who is an attorney. So you would think that someone that is an attorney would not have a major disruption in their life. Courts are closed. People are not coming in for attorney services, so there's no billable hours. Because of that, there's no income in her home. You think of an attorney, you don't think of an attorney needing resources for mortgage, for food, and also the stigma or the embarrassment associated with asking for help. Another, my hairstylist, who has 2 small children, 6 years old, and she had to change her hours to evenings so that she can stay at home and educate her children. She's not a teacher. She has 6-year-old twins. She says as she's trying to teach her children, her daughter is saying, "Mommy, that's not how Mrs. Smith does it." And at the same time, her 6-year-old son, he's playing Spider-Man instead of sitting in front of a computer. These are real life issues. And then lastly, a team member, a staff member that I am assisting, who had to choose between working or staying home and educating her children who are learning remotely. She doesn't have the opportunity to work from home because she's a frontline worker. And to choose between not working, that means no income. This is it's a sad time anytime, but particularly now around holiday seasons. And how do you choose between food and housing, and as children want toys for Christmas? So this is having an emotional toll that no one could ever had imagined. But these are people, you hear stories, but these are frontline lawyers, doctors, because doctors' elective surgeries have been canceled. Their income has been cut by 20%. And so any income, reduction in income, is a loss in your home. So this video was very important to me personally, to be able to tell these stories of people I know personally. These are not just faces on a TV. These are people who are instrumental in my life, and I want them to know that there are resources available without shame, without embarrassment, but to ask for help, or for them to allow me to help them get connected to the resources that are out there. So thank you, and please remember, there are people hurting in ways you could never ever imagine, and they may not just share or allow you to know the pain that they're going through. So I just thank Commissioner Driehaus for her vision, and for the rest of my peers on the Commission on Women and Girls to be able to have this conversation and to share with everyone what the human toll is for this pandemic.
Thank you, Valerie. Thank you. Very well said. I really appreciate you articulating what the thought process was going into producing a PSA. So we're asking folks to amplify this message. Once you see it, you'll know why. I also want to give a big shout out to the Commission on Women and Girls, all the members that participated, and the members that didn't participate on the video but supported the effort, and also Fatima Ba, who is my legislative aide, who had just did a lot of work on this, and Bridget Doherty, too, our communications director. So with that, let's go to the video.
have a hard time with online learning.
I wish I could afford counseling like I used to.
I have a hard time feeling balanced, taking care of my family and work.
I feel anxious.
I feel stressed.
I feel stressed when others don't wear masks.
My friend is in a domestic violence situation that has escalated during the pandemic, and I don't know how to help.
I feel I can never see my friends outside of school.
Being a single mother during a pandemic is hard.
I don't want my friends and family to know that I'm struggling. COVID has been really hard on me and my family.
The pandemic has erased years of economic gains for women.
And is poised to leave lasting economic scars.
For resources, please go to hamiltoncountyohio.gov. All right. Thank you. So we are going to turn it over to Greg to talk about the numbers and the trends, and then we'll go to Dr. Lofgren to talk about hospital capacity. Greg.
Thank you very much, Commissioner Driehaus, and good morning. So over the last week, we have continued to see a slight decrease in the number of cases here in Hamilton County, which is absolutely a good thing. Our hospitalizations, they continue to remain very high, and as we'll hear more from Dr. Lofgren, they are at an alarmingly high number that is causing burden for our hospital systems, as well as their teams that are working to keep us safe. I'd always like to start off with talking about testing, because we have so much opportunity here in Hamilton County to get tested. If you have symptoms or feel like you need to get a test, we encourage you to visit our website, hcph.org. That will link you to the Health Collaborative's website as well, the Test and Protect program. We also have a map so you can find testing locations close to home. Testing has not been as long of a wait. Typically waits are just 15-20 minutes, and results are often coming back within less than 2 days. So really great opportunity to get tested. I always like to remind people though, if you have symptoms of COVID-19 and you get tested, it's super important that you stay home until you have your test results. We don't want you out and spreading COVID in our community. Let's dive in and look at cases real quick. We have had, as you know, a really bad month last month. Cases just were skyrocketing. And I am proud to report that now for over a week and a half, we have seen a stabilization of cases. Unfortunately, our case numbers are so high right now, we still are doing a lot of contact tracing work and dealing with COVID within our community, but we are very pleased to see these cases finally stabilize and not continue to rise. We are seeing these cases continue to come from all areas of our community. In the last 7 days, cases were from all age groups. We did see the largest number of cases still in the 18 to 29-year-old age group with nearly 900 cases. In addition, for those over 70, we had 360 new cases. Clearly, this can have a contribution to the number of hospitalizations that we're seeing within our region and here locally. Very closely tied to the increase in, or to the stabilization in cases, is our reproductive number. For over a week now, our reproductive number has been at 1 or just below 1. Today we are at 0.97 for Hamilton County and 1.0 for the region. Turning over to hospitalizations, you know that this is a delayed indicator. Individuals that get sick take a couple weeks before they need hospital care. The top graph represents Hamilton County. You can see we did have some increases over the last month of hospitalizations. We're sitting right around 10 hospitalizations per day. Things have come down though in the last week, which is also a good thing. However, when you look at the region, which we have to do because our hospitals share resources within the region, those numbers continue to skyrocket. We were, last week when I stood here, we were closer to 650 cases of COVID-19. Today we are closer to 750 cases of COVID-19. So just a ton of growth within our hospital systems. I can only imagine the burden that this is putting on these systems. We'll hear more about that from Dr. Lofgren in a few moments. The same thing is happening within our intensive care units. We've seen a 6-fold increase in these intensive care units. We are now at 175 individuals, 15 more than when I was here last week. So this number continues to grow exponentially. As I conclude today, I do want to say thank you to those of you that have made personal sacrifices and contributions over the course of this pandemic. You heard a plea from myself and many others, including Commissioner Driehaus and other leaders around our community, asking you to make contributions during Thanksgiving. None of us wanted to adjust our plans, but because many of us did, that will go a long way for our community. If we want to support our local businesses and restaurants and other activities, we have to continue to work together safely. Please continue to minimize your unnecessary travel outside your home, but at the same time, continue to try and support those local businesses and stores. Consider shopping online from those local locations so that we can help our economy here locally. In addition, I'd like you to support stores that are COVID safe. You've heard me talk many times about the importance of only going to locations that you feel comfortable and safe. If you go to a store and they're not safe, let them know that you're moving on because they're not taking COVID seriously. But probably more importantly, if you go to a store and every employee is masked and they're working really hard to make sure that their customers are masked, please take the time to say thank you and appreciate the contributions that they're making. Please always wear your mask, social distance, and wash your hands. It's a very simple message, and you've heard it for a long time. And working together as a community, we will get through this pandemic. Thank you.
Thanks, Greg. We're going to turn it over to Dr. Lofgren now to talk to us about hospital capacity and really, just kind of on the ground what's happening throughout the hospital system. So, Dr. Lofgren, thank you for joining this morning.
Thank you, Commissioner Driehaus, and I appreciate having the opportunity to speak with you today and really kind of building upon the comments that Commissioner Kusterman just covered. I would say that what you've seen and experienced and we've seen over the last several weeks is in our community really an exponential growth in the number of cases. The number of people who are testing positive, the number of people who have acquired the infection. And quite honestly, as a reminder, and I'm sure that all of you now have experience with this, is that people are actually, by and large, the majority of people do well. I think when we saw the introduction of the virus, many of us didn't know anybody who had acquired the infection. I think all of us now know somebody, if either directly or fairly directly, that actually has. And the truth of the matter is, and fortunately, the vast majority of people actually do well. However, a significant minority of those individuals have serious complications related to this infection. So a small percentage of a large number of cases means that translates into a large number of individuals who are sick and sometimes severely sick and require hospitalization. So the growth in the hospitalizations has really follows this exponential growth. When this started really ticking up in the beginning part of October, the health systems were more than able to accommodate the growth. I would tell you at this point in time, that growth is pushing our health systems and they're well on the verge, and in some areas actually stressing our health system's ability to accommodate. One of the things that I would say to put in perspective is that over the last 60 days, we've seen about almost a 700% increase in the number of people hospitalized in our region, going from a little under 100 at the end of September to actually what Commissioner Kusterman said, over 750 today. 60 days ago, in our hospital systems, about 1 in 30 individuals in the hospital had COVID. We're now at a point where about 1 in 4 is in the hospital now has COVID. Now, that varies a little bit by percentages. These are very fluid because one of the things we've done as a community is that we've expanded the number of beds in terms of taking facilities that we weren't using at full capacity, finding more capacity within the systems. But I think that the general trend is really there, is that 60 days ago, the beginning part, end of the part of September, a very small percentage of the people in the hospital actually were there because of COVID. Now it's actually quickly becoming about a quarter, certainly 20 to 25%. And where we're feeling the stress, I think, in the greatest part is actually the capacity in our critical care units. So I think our ability to take care of individuals in the normal hospital beds has been able to accommodate at this point in time reasonably well. But even today, we're finding that the ICUs around our region, many of them very much stressed at this point, and the ability to take on more critically ill patients. In response to that, what we're seeing in the region varies a little bit by health system, depends on the push they have, but we're starting to see organizations, including our own organization, that's deferring some elective procedures. And unlike the spring, we did that because in the springtime, we didn't have enough PPE to protect our workforce. And we had to shut down those activities that consumed PPE so that they were available for the workers who are in the front line taking care of patients actively infected. The good news is that we've really done a good job of maintaining our supply chain. We always keep our eye on it, but right now we appear to have adequate amount of PPE to protect our workforce and to protect our community. And we really seem to have enough supplies such as ventilators and the like. What we don't have enough of are the frontline workers who actually take care of the patients. So for us, the issue that really pushes us and our ability to respond is really the staff. And even in this surge that we've been able to accommodate, we're asking people and nurses and other physician and healthcare workers to work overtime or double shifts and to sort of stretch themselves. And obviously, in some cases, that's not sustainable. I think the other thing that's different, of course, is that typically in the healthcare industry, if you really actually have a big surge of volumes, you're able to go out and find help that's what we call travelers or agencies that help supplement our workforce. And though all of us are busy out there trying to identify those people, part of the issue right now is that there are multiple cities and multiple areas across the country that are experiencing the same sort of surge. And so the ability to move a cadre of healthcare workers from New York to Detroit to New Orleans that we did in the spring really isn't as available. So we really are understanding that we are in the process of making sure that we understand how we can accommodate the uptick. But we're already starting to feel, I would tell you, at the ICU level, some of that sort of pressure. Right now in the med-surg, our capacity around the community is we're able to accommodate those patients, but we see the sort of the wall coming. In that regard, then the healthcare systems meet and the chief operating officers and chief medical officers and leaders of the health system meet and talk every day so that we have a situational awareness of where we are, how we can collaborate, how we can anticipate the growth in these potential cases. So I would tell you that at this point, a much larger percentage of the care that we're delivering in our hospitals, in our community, is now taken up by people who have COVID. It is currently, I think, stressing our ICUs and actually it's starting to push a little bit our overall capacity as well. The thing that all of us in this in the region are really focused on is really I'm trying to determine how we can actually protect our workers, use them effectively, and to stretch that. But that's really the issue that we are probably wrestling with the greatest in the community. With that, I think I'll stop and hand it back over to you, Commissioner Driehaus.
Thank you, Dr. Lofgren. All right, Bridget, I think we are ready to go to questions.
John London of News 5 is up first. He has questions for Commissioner Kesterman and Dr. Lofgren.
Good morning, John.
Yeah, Dr. Lofgren, we will hear from the governor tomorrow regarding the vaccine distribution, and I'm wondering if you could address what's in place or needs to be in place locally for the initial batch, the storage, and how immunization would be carried out in this region.
Sure, and I know that Commissioner Kesterman has been at the forefront of that, and it's really in stages. So we already are prepared as a region and a state to receive the first batch, which I think may be as early as the middle part of the month. And where the distribution is they've had 10 sites identified across the state that we've received the first batch to start to vaccinate the 1A or healthcare workers. But quickly following that, they anticipate to having more availability of vaccines and a cascade of distribution. But In fact, I think the goal is, in many respects, is to actually distribute, and you might have seen this, and they're already starting to distribute some of the vaccine in anticipation that the emergency use authorization will occur in the middle of the month, so that sort of the moment that it's been approved, that we can at least start the process of vaccinating healthcare workers. And Greg, I don't know if you wanted to add to that as well.
I think that was a pretty good summary. We are set up here at the county working with our EMA. We have purchased enough refrigeration to handle plenty of vaccine. We have ultra cold storage at this point to handle 65,000 doses of COVID vaccine. In addition, we're very close to having a second unit installed that can also handle twice that. So we have plenty of storage and capacity, and our goal as soon as vaccine is available to start getting it to those that need it. So we're ready.
And Dr. Loughran, just one other thing. Can citizens choose the vaccine they want? Like if I want Moderna, since it can be, I think, stored longer than the Pfizer vaccine, would I be able to, sometime in 2021, indicate that to my doctor, and would he or she have to offer that, or would it be just whatever's available I'd have to accept?
Well, the question is a great one, and I have a little bit more of a personal response than what you're really directly asking, is that, when I look at this pandemic and we have a couple different vaccines that are highly effective, I think the most important things is that we vaccinate our community and protect our community as quickly as possible. The good news is that, we have a couple vaccines such as the Moderna and the Pfizer ones, and we have a couple that I think on the horizon, so that hopefully in 2021 we actually will have several. And I think the issue first and foremost is how can we get the most amount of vaccine to the most amount of people. As we learn more about it, will there be some selectivity, or is there some differences between the two? That could emerge, but I think that right now people are focusing on making sure the vaccines that are being developed are effective, are safe, and as Commissioner Kesterman said, we think about the distribution. But as it starts to come in, it will always be some choices involved in terms of that, but it'll be a combination of availability as well.
And I know a lot of people, we have other folks that have questions for you, but just real quick, there's a lot of people that have had COVID. Should they assume immunity at this point and wait until those who haven't had it get vaccinated?
I know that the trials right now intentionally did not screen people to see whether or not they had COVID before in the vaccination trial, because they really are going to be suggesting, because we don't know how long the immunity has, if in fact you've had COVID in the past. There's a lot of science to be known about that. But right now, I believe, as the initial recommendation is that we have the vaccination cascade based on prioritization that they've worked on in screening for people who have had infection. At this point in time, I do not believe is part of the process. The idea is that we just don't know enough about the level of immunity that would come from having COVID in the past.
Thank you. I'll have a couple more questions later. I think I'll let others ask you.
Next up, Marielle Carbone from WCPO has questions for you, Dr. Loughran.
Hi, Dr. Loughran. Main question, I know that Commissioner Driehaus says that it's too early right now to see the effects of Thanksgiving, but obviously we know people traveled. We know people gathered in groups. So based on seeing that, how concerned are you for the upcoming Christmas holiday when it's likely even more people will end up traveling?
I think that the real issue is not only just the travel, but is how you spend your holidays in whether or not you actually expand your bubble. So if in fact you traveled and you maintained social distancing and you maintained the masking, then the amount of spread that occurs should be much less. On the other hand, if in fact you didn't maintain the social distancing, then we are concerned about that. We tend to see the impact of the spread delayed by about 2 weeks. So we'll start to see the impact of what's happened or didn't happen around the Thanksgiving holidays in the middle part of the month. It first starts ticking with hospitalizations. Then about 5 to 7 days, we'll see an uptick in ICUs. And then a couple of weeks later than that, we start to see an uptick in deaths.
So are you hearing that people within the hospital are scared? Are they concerned about the influx they could be seeing within the next week that will kind of continue with more holidays coming up, Christmas and New Year's?
I think it's safe to say that all the healthcare systems are concerned and are making plans to anticipate that there'll be a continued growth in hospitalizations. So they're all actively planning in terms of contingencies and things that they will do if there's a continued influx of patients.
Awesome. Thank you.
Thank you.
Next up, we have Corey Sharber from WGXU, and he has questions for both Commissioner Kesterman and Dr. Lofgren.
Thanks for taking my questions. First question for Greg. I just wanted to make sure I got the numbers right. Is this the third week in a row we've seen nearly 4,000 new cases confirmed in the county, or are there more weeks we've seen this many cases?
I think 4 weeks in a row is accurate. Yes. Okay.
Question really for both you, Greg, as well as Dr. Lofgren. I just want to get a better picture since we're having so many cases per week. How many of those cases turn into hospitalizations, and then how many of those hospitalizations turn into deaths in the region?
So to date, we've had 33,874 cases of COVID-19 and 1,673 hospitalizations, and deaths 376. So I haven't figured out the percentages, but it could be figured out from those numbers.
Yeah, I don't have the math in front of me. I think there are a couple things that is true is that since the spring, we are much more effective in treating the disease earlier, so that a smaller percentage of people, I think, who get infected have to be hospitalized. And we're much more effective in treating patients who are sick, so that a smaller percentage than compared to the spring require ICU care. The other thing that has actually been useful for us to accommodate the upsurge is that the length of stay that somebody needs to be in the hospital has actually gone down relative to the spring. But again, as Commissioner Kesterman said, it's still a sizable percentage of a very large number. And that's really where I think our planning as a health system and our concern, and I really want to make sure that people hear loud and clear, we are very concerned about the trajectory. And as you've looked at the graphs, in the regional graphs, there's nothing in that graph that says that anything is slowing down at this point in time.
Another question I have for Greg. Why is the 18 through 29 age group making up most of the new cases? What trends have you guys been picking up on with that age group?
We have not seen any one particular activity that would contribute to that age group seeing a higher increase, but it does clearly show that there might be more movement for that age group, meaning they're not hunkering down and staying put. They're still in some ways, shapes and forms getting together with friends and congregating. And so once again, it's a message that we need to be very careful if we're out and about. Wear those masks, social distance, and heed all of the warnings that you're hearing from public health.
I have a question for Dr. Lofgren. I just wanted to make sure I got your statement correct. You said that the region has seen a 700% increase in hospitalizations in the last 60 days. Is that correct?
Lofgren?
Is he still here?
Yes, he is on mute.
And I'm chatting it up, and I'm on mute. I was just doing the math here, and so it's between 600 and 700%. So and it gets back to, for example, the numbers that are a little fluid, and I would, when I start to quote numbers, is we went from 1 to 30 to 1 to 4. Now, part of that changes because we actually we've activated more beds, so to accommodate the needs. So, but it's the magnitude that I would really want people to understand, is that there's been this decisive shift in terms of our need to accommodate patients who are affected with this virus.
And Now, I know that UC Health has recently paused elective surgeries due to the overall load of cases coming in, the patients. Is it safe to say hospitals are reaching max capacity in the region? And if not, how close are they to the breaking point?
So I think that the issue is about where, like anything, any system, when it gets stressed, you sort of see the things that are most vulnerable. And I think that what we see right now is that the demands for ICU care is the biggest push we have. And our planning is really about how we can safely and effectively staff. So part of it is that it allows us, and pause is that allows us to redeploy staff as much as it is, facilities and beds and the like. It's really about, particularly at UC Health, where we take care of particularly critically ill patients, we've been feeling that pressure on our staff and on our capacity to take care of ICU patients. We're expanding the number of ICU beds by actually today to accommodate more patients in terms of critical care. So that's where we're feeling the immediate pressure.
And the last question I have for both you, Doctor, as well as Greg, and I know the data still hasn't, we still don't have all the data available because it's only Wednesday. How big of a spike is expected from all this? Like, what preparations is the county making and the region making in order to keep everyone safe?
So from a public health perspective, our biggest role is managing the contact tracing and reaching out to individuals. We continue to hire more contact tracers. In fact, today alone, I signed 3 new contracts, bringing on 3 full-time individuals to do this work. We will continue to prepare and make sure that if we do see a surge, we're ready for it. The truth is, I'm really hopeful that some of our messaging over the last month has had an impact, and maybe the surge won't be as big. Am I being too hopeful? I'd like to believe not, but only time will tell, and we'll find out hopefully next week that folks did a good job with managing their COVID footprint.
Corey. Next up, we have David Winter from Local 12. He has questions for Commissioner Kesterman and Dr. Lofgren.
Sure you don't have any more questions, Corey?
If you, I might think of a few, so I'll let you take the floor from here.
All right. Hey, if I could, let me start with Greg. And Greg, you just alluded to it, but the way I understand it, Butler County has pretty much said that it's ditching contact tracing because it's just overwhelmed. Obviously, you're not at that point if you say that you're going to hire 3 more people, but at what point are we going to get overwhelmed, or are we nearing that point of getting overwhelmed with contact tracing?
There are many different strategies for handling contact tracing. I read the Butler County press release discussing it, and they are still doing work associated with positive cases, but they're asking their positive cases to assist with calling those close contacts. There are many different forms of reducing the workload of my team. One of the things, in addition to hiring, that we have done is reduce the number of questions on our questionnaire. So that means each contact with a positive case takes less time. And so we've implemented some of these strategies in addition to hiring so that we're able to be as effective as possible. We work closely with the State Department of Health. We've actually requested assistance from them as well, kind of gearing up and making sure we are ready. I asked for 25 additional people from the Ohio Department of Health. That was very optimistic. I don't think I'll have 25 additional people, but I put in the request so that we're ready and have the necessary staff to do what we need to do. We're going to continue to call each person as we get the cases and manage the load in front of us.
So how many people do we have working on contact tracing?
Last count I had was 92, and that does not account for the 3 that I signed today, and I know I've signed a couple others this week. So I'm going to put the estimate close to 100 individuals doing contact tracing.
All right. And then if I could, Dr. Lofgren, why is it that that UC and all the hospitals in the region refuse to talk about specific numbers as far as the number of people who are hospitalized. Other states, other hospital systems, they say we've got 3 beds left. We are at 92% capacity. Why is it that UC and other hospitals in the region will not talk about specific numbers so the people in this area know exactly where we stand?
We look at the occupancy on a regular basis. I don't know if we've, and it's obviously very fluid, so that last week we were at 95%. Today we're at 86% because of the discharges. We monitor it as a health system all along. I actually didn't know or never really thought about what we put out into the public domain. So it's probably something we can talk about, but I would tell you that it does vary. For example, we had a large number of admissions, but we had a large number of discharges. And so a number of our facilities that last week were saying that they were at 90+% capacity now have capacity because of the fluidity of it. Are there ICU beds available and the like? We keep, it varies by institution. So there are facilities right now that does have ICU capacities. There are facilities that are full. We do collaborate across the entire region so that I know that within the health systems themselves, they'll actually move patients from where they have availability. And we will load balance between our organizations as well.
Yeah, I realize that. And sorry, just to press this point a bit further, since I'm talking to the main man, it is a fact that your PR people will not talk about specific numbers. They defer to the Health Collaborative, and then the Health Collaborative will not talk about specific numbers. As a citizen of this area, I would like to know personally, and I know that other viewers would like to know exactly, even if it's an updated list on a daily basis posted somewhere, how many beds are available, and things like ventilators and so forth you say are available and so forth, but we have no idea what those numbers are.
Well, I think then what I will follow back to you is I'll go back to the Health Collaborative and our PR folks and have a better direct understanding of what we are conveying and not conveying. So, I would tell you that I don't specifically know what we are communicating. I appreciate the feedback, and I think the comment is well taken, and I will take it back.
Thank you.
London from News 5 has a couple follow-up questions.
Yeah, just a real quick, Dr. Lofgren, since I hear from people who think, with this vaccine rollout, that once they get the vaccine, life goes back to normal. And I wonder if, would like to hear from you, since we don't know how long the vaccine will last, and since, as I understand it, it would still be possible to transmit to others, will masking and social distance be the norm, do you think, through 2021 and perhaps into 2022?
So I think your perspective is accurate, meaning that there are a couple things we need to do with the vaccine program, and Commissioner Custerman, I think, is well aware of it, is that we need to get as much of the community vaccinated, because not only will it protect the citizens, but it will also finally stop the propagation or spread within the community. Really, ultimately the issue around herd immunity. That's how we get the virus to burn out. And there's some debate about what percentage of the population has to be protected and which to do that, but it's clearly more than 50%, and many people think it's as high as 70%. So, and until we reach that, it's still possible, very much possible, that the virus will be could spread into the community, which is a way in which I'm comfortable that we are going to still need to maintain masking and social distancing until we have effective, massive vaccination program in place. And you've heard different estimates, I think, from the experts, but it's certainly going to extend into the summer. And how quickly it all rolls out, I think we're all optimistic about it, but I think until we really have that, we are going to have to maintain the measures that we know that will prevent the spread of the virus: social distancing, masking, washing hands.
Thanks for all that. And Greg, so just one final question to you, and please don't take this as argumentative, but you know, we hear from people, and the governor the other day said, I think he said 90% mask compliance is what the health folks are telling him from around the state, yet the numbers are soaring. We know that masks work, or at least we're told over and over again that masks work. We always heard 80 to 90%. That, and as the governor said at one point, if we reach that, we will kick this. So is the messaging off, Greg, on this, or is the virus spreading despite the masks and the social distance? What accounts, I guess the question is, what accounts for the soaring numbers if we have 80 to 90% mask compliance in the state?
Fair enough. Thanks, John, for that question. You know, I think when you go out to a retail setting or to a store, if you look around, say you're at the grocery store on a Saturday afternoon when it's crowded, almost everybody is wearing that mask correctly. I see a few noses hanging out here and there, but for the most part, probably here in Hamilton County, even more than 90% of individuals are wearing that mask correctly. The same holds true from hardware stores to folks on their way into a restaurant and in many settings. But unfortunately, this message doesn't hold true when I have individuals come to my house. I have gatherings of friends and I let my guard down. And it's in those small groups where I truly believe we see a lot of spread. And that's why Commissioner Driehaus, myself, and many others, as we led up to Thanksgiving, put out such a strong cry for individuals to take some responsibility in slowing the spread of this virus. We know that holidays are a time where people do come together, and even individuals who normally don't have gatherings at their house will have gatherings for holidays. And so all of these small individual gatherings contribute significantly to the spread of COVID-19. And I really believe that's where we're seeing spread still happen in our community at the highest rates.
Thank you.
And that seems to conclude our questions from reporters.
Well, thank you. It's been a bit of a marathon this morning, but a lot of good information. So thank you all for joining. A special thanks to Valerie Boykins, who joined from the Commission on Women and Girls, Commissioner Kesterman, and Dr. Lofgren. Thanks. We'll be back next week.
Thank you.